My name is Emily and I'm a second year Bachelor of Midwifery student studying at the University of Technology, Sydney. I'm currently taking the subject Power and Politics in Midwifery, through which I've been learning about the power imbalances that are prevalent throughout the birthing system, and today I'll be talking about obstetric violence and sharing an example that I witnessed firsthand in the maternity setting. Obstetric violence refers to any kind of abuse to a woman during pregnancy, childbirth, or in the postpartum period by a healthcare professional. It can manifest in various ways, including physical or emotional abuse, non-consensual medical procedures, bullying, coercion, neglect, and the dismissal of a woman's right to bodily autonomy. This type of violence is now recognized as a violation of human rights and a form of gender-based violence. When talking about obstetric violence, the physical and psychological effects can be profound and long-lasting. Some of these effects include higher instances of postnatal depression and anxiety, PTSD, and birth trauma. Women who have experienced obstetric violence have been documented as saying they felt disempowered, violated, and dehumanized during what was supposed to have been one of the best moments of their lives. A national survey in 2021 called the Birth Experience Study revealed that a staggering 58% of the women surveyed reported either yes or maybe to experiencing obstetric violence at the hands of their healthcare provider. Further, a recent inquiry into birth trauma in New South Wales, where obstetric violence is a significant concern, revealed that 1 in 3 women experience birth trauma. These statistics just highlight the systemic issues within the current healthcare model, such as a lack of the concept of informed consent, lack of trauma-informed and woman-centered care, and insufficient staffing and resources in the maternity setting. I can recall one instance specifically that sticks out to me, where I supported a woman through her pregnancy and birth journey as her student midwife towards the end of last year. The woman was progressing slowly, and after a long labour, she needed to be examined again. A doctor came in to perform a vaginal examination with the hopes of her being fully dilated and ready to push. Before the exam was carried out, proper informed consent was not obtained, but he started anyway. Not only was it not obtained, but it was blatantly disregarded when raised by the midwives. He kept his hand inside the woman while she contracted and decided once again without consent to attempt to rotate the baby. During this period, the midwives were again trying to remind the doctor to properly discuss with the woman what was happening, but again he did not listen. This VE ended up in her having an APH from a tear in her vaginal wall, and she was rushed to theatre to have an instrumental birth and an episiotomy. I saw her twice postnatally, and she was beginning the process of counselling and wanting to book an appointment to talk with a trauma midwife to discuss the whole experience. Not only did this instance of obstetric violence impact her psychologically, but she was also told that a C-section would be recommended for any further births due to the severity of the trauma that she endured. This is just one of many instances that happen not just in my district, but across all of New South Wales Health, and I think that addressing the issue of obstetric violence requires a multifaceted approach. First, raising awareness among healthcare providers and the public is crucial to recognising and addressing the issue. It's important for pregnant and birthing mothers to know their rights. From my own experience in the hospital clinic, it's becoming clear how many women aren't confident enough to speak up and how many women don't even know that they have the right. Implementing trauma-informed care practices and ensuring that healthcare professionals receive training on respectful maternity care can help prevent such incidents. Policies and guidelines that prioritise informed consent, patient autonomy and dignity should be enforced across all healthcare settings. Additionally, providing women with access to support services such as counselling and advocacy groups can help them heal from their experiences and empower them to speak out. On a systemic level, increasing funding for maternity care, improving staffing ratios, and promoting the continuity of care model can address some of the root causes of obstetric violence. Encouraging open communication and feedback between patients and healthcare providers can also foster a culture of accountability and respect.